Okay, so we're gonna look in. Hey, thank you so much for coming to do this for me. I know it's like super casual. I can rent out the labs. It's just cranial nerve exams, and well, there's a little bit of sampling if you're okay with that. I'm not gonna be like cutting you or anything, but I just wanted to do like a little scrape on different parts of your face to take a little skin sample. You're a good friend. I couldn't get anybody in my class to do this, so I had to ask all my friends about it. I'm gonna start with the ear ones. So we're just gonna check your hearing, the cranial nerve thing. But I do want to take a look inside really quick, check for any perforations or impactions, whatnot, before I start subjecting you to the tests. Okay, I'm sure you've seen one of these before. I'm gonna be sticking inside your ear. So I'm just gonna get close to you. I'm gonna be touching your face a lot. Okay. Okay. So we're gonna go inside this ear, and I'm just gonna be checking for any like previous perforations, current perforations. You don't have that, and I'm not seeing any eardrum scarring or anything, so that's good. Got a different speculum on there really quick. Okay, going back in. Okay. Well, remember the last time I did this? Yeah, well, it wasn't for the ears. Your ear looks beautiful, like an ear should. Is that a thing you should tell your friends? I'd be honest, if your ear looked terrible, I would tell you. That's the kind of friends we are. Okay. And this one, no previous preparations. Your ears look really good. I think that you are totally going to be able to hear well. Well, I think all of your hearing problems in that respect is just that you're not listening to me. Okay, well, we do want to check. Okay. Right, then, well, that's not the test, so I just want you to ask me, I'm just going to make some noises with my gloves. I want you to tell me approximately where they're coming from. Ideally, a direction, up, down, left, right of you. If you want to use cardinal directions, go ahead, confuse me. And the closeness for which you hear them, okay? All right, you ready? Okay, another one. You could close your eyes, that would, yeah, close your eyes. Okay. Okay. See, you're good. Let's do 2 at once. Okay. Okay. Yeah. Okay. It's just quick checking to make sure you're good there. It's just a pass or fail in that one. But now I'm going to whisper words to you. I just need you to repeat them to me, okay? You ready? I'm gonna get in close. Sycamore. Japanese maple. Okay. Willow. I said that one kind of. Here. Willow. There you go. Okay. Oak. Right. Yeah, I switched that up. Well, if I just did trees, it would be too easy. Lavender. Okay. Good. I'm going to do numbers now. And I'm going to cover up your other ear while I'm doing them, okay? 22. 250. 73. I know it's a weird test. You threw me off. 55. Stop it. Okay. I just have to make sure that there's no bruising on your face before I... Yeah. As your friend and as your current, I don't know, experimenter? Researcher. I like that better. I'm not feeling any pain when I do anything, right? I know you'd probably punch me. Well, like that time that I, like, poked you really hard. I still have a scar from that, thank you very much. I know, I'm giving you so much shit, but I'm really thankful that you're doing this. So we were supposed to get, like, I'm going to start smacking your face in places. I'm just looking for a reaction. You don't have to do anything. Right, well, they didn't, everyone is doing a slightly different thing in class, and nobody was really interested in what I was doing. Comparing bacteria and facial features to the efficacy of the cranial nerves, essentially. It's complicated. I wouldn't be able to explain it to you. I'm just being an asshole. I'm sorry. You're not feeling any pain from anything I'm doing, right? I know. I have to ask. Okay, I'm going to be doing your ears now, okay? I was just doing, like, around your ear, but now I'm just very gently, like, doing your actual ear. You know, I don't know why it's always 2. I could do more. I could do less. Right? No, it's weird when it's not 2. I have to do 2, sorry. It's required. It's medically required. Okay. Right there. 1 second. It's your ear. No, it's just I was taking a note on ears first because this is the most confusing section for me. The visual stuff, the smell, that all makes sense, but the ear cranial nerves, like, confuse me. So I was taking notes before you came. But don't look at my research. Okay, I'm going to be doing your face now, just because we're doing... Okay, I'm going to be gently touching your face, okay? And then also gently smacking your face. Okay. Quick note. Nothing to worry about. Just points of interest. Okay. Curious. Alright. I would like to, since we're on facial, we'll go ahead and continue with facial. We'll do vision and smell last, I think. But I want to work on I'm going to touch parts of your face and put pressure on them and ask you to essentially counter that pressure with the muscles in your face. So I'm going to push down on your eyebrows like this. And I need you to be like, whoa, I need you to be surprised. Be surprised that I'm pushing on your eyebrows. Okay? And then opposite, I'm going to push up and I need you to scowl at me. Like you always do. Okay. I'm going to be pushing on this side of your head. I need you to counter that for me, okay? Okay. Other way. Okay. Forward and back. Okay, so counter that with your neck. Okay. I'm going to push you towards me. I want you to push your head back. Okay, lift your arm for me. Same thing with your arm. I'm going to push on it, and I just need you to push against me. Ready? Okay. Pulling it toward me. Push against. Okay, you got this. Other one. Okay. Okay. This one's fun for me. This is the soft, sharp test. I'm going to be poking parts of your face all over with either this very sharp wooden object or this very soft Q-tip-like object. Okay? You tell me whether it is. Close your eyes. Sharp or soft. Here we go. Okay. 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 Keep them closed. Okay. I will be getting close to your eyes, so don't be nervous. Okay. Right by your ear now. I'm gonna do that one again. Same spot. There you go. Okay. Just for good measure, I'm gonna poke it again. Okay, you got it. Sharp or soft? Okay. Sharp or soft? Oh, that one, yeah, that one. Yeah, that was soft. Sharp or soft? Really close to your eye. Okay. Sharp or soft? It's like the worst game show ever, right? Today, sharp or soft? I feel like what you would win would be really lame too. Okay. Seems that your skin is able to tell the difference between a sharp thing and a soft thing. I know it seems really dumb, but you can only do that because of certain nerves that you have that are working properly. I wanted to finish up your hearing test really quick with just a slightly different tone. Okay, just need you to tell me where, according to your head, your body, the sound is coming from. Okay, you ready? Okay. Let me know if you need time to think about it. Don't give me cardinal directions, please. You know I'm terrible at those. Which way is west right now? Yeah, right way. Okay. You're the worst. Honestly, driving made a huge difference for me, but I'm still absolutely geographically challenged. And my inability to tell cardinal directions is one of those reasons. Go right up in there. Okay. Okay. Your nerves are glorious, my friend. It's not a medical term. I can't put it in your chart, but okay, I think we're done with those ones. Let's go ahead and move on to the sight ones because those ones take just a little bit. And I really, really wanted to make sure that I get enough samples before you go. Snellen Eye Chart, very basic, just to check. I already know what your vision is, but I do have to test it. What is this letter? It's always an E. I've never seen a chart with anything but an E at the top. I couldn't tell you why. I bet there's a reason though. I'm gonna move down to here just because you were acing it. Okay. Can you read this last row? Okay. That's right. Okay. I'm going to cover up your eye now. I'm going to use this even because, you know, I like multitaskers. And I'm just going to hold up a number of fingers. First, I'm going to start by covering your right eye. Okay? You got this? How many am I holding up? Okay. I don't want you to turn your head. Okay. I want you to just move your eyes. Ready? Okay. Well, yeah. Child of the 90s. Okay. Don't move your head. Okay. Other side. Covering it up. Like that. Ready? Okay. I can't help myself. I'm sorry. Okay. Good enough. I'm going to shine a brightish light into your eyes now. First, I have to get in kind of close, okay? And I am going to kind of be checking in your pupils, so I'm just going to bring this really close. And then I'm going to bring it far away, and I'm just going to be looking at your pupils, okay? I need to look over to the side so that I can. There we go. I'm just trying to make them wider so I can look inside, and I'm also making sure that they're constricting properly. That has to do with that ocular nerve there. Okay. Other side. Other eye. Okay. Just watching it. Okay. Okay. Great. Now I just need you to follow my light. Okay. Again, don't move your beautiful head there. If you do, I'm going to smack you. No, just your eyes. Okay. I'm going to go fast to start. I'm watching on your eye, like your fast twitch muscles in your eye there. Okay. Okay. We're going to sneak in from the side here. I didn't even have it on. I was fooling you. Follow, follow, follow. Okay. When you see the light come into your vision, I want you to hold up your hand or say something to me just to indicate when you see it. Are you ready? Okay. I know, it's spooky how much I have to stare you down, right? Okay. Alright, we're going to come in from diagonal angles. Okay. I will say the lack of lab setting turned off some of my classmates. And probably the fact that I'm kind of an outlier. I'm a lot older than most of them. Okay. Vision looking stellar. I'd like to get in close to your eyes again and do a test that no one likes, not one person I've ever talked to, where I poke your eyes with a soft Q-tip. Alright, I'm just going to be getting really close. I need you to keep your eye open for me. Ready? And I was just making that sound so you knew it was happening. You closed your eye, so it didn't work. So, okay. Very good. Okay. Keep them open. I need to actually touch right there. Okay. And right there. Okay, great. We're done with the eyes. Last, before we move on to sample getting, is my favorite. I love the smell test. I am going to put a bunch of disgusting smells under your nose, because that's the kind of friend I am. I mean, some of them are, it's all subjective, right? This one, let me read the bottom. This one, well, I can't tell you, so. Okay. Smell that. Yes, very good. Okay, this one's in liquid form. Yeah, that's my least favorite. Some people like that smell, but it's not for me at all. That one's the only one that's liquid for some reason, though. Everything else is in, like, salts. Okay. Smell that. Well, they all look the same so that you can't tell, because a lot of times people don't close their eyes. I have a couple more. Hold on, though. Let me... No, you got it right. I'm just writing a note about something else. Okay, get a big old whiff. Okay. Now, one more, and then I have to have you plug your nostrils. Oh, that one. That's good. I love that one. Vanilla is the best. I don't know. Alright, you got all of this right, but I would like you to go ahead and I don't want to touch your nose, so it's all on you. To cover up your left nostril, please. And we're going to go through the same scent in a different order. Not the liquid one, because you'll know what it is. Okay. Good. Well, we are going to do the same thing with the other nostril, but we're only going to do 3 of them. But it will be randomized. Okay. Very good. Please plug your other nostril now. Of course I'm going to do the grossest one again. What kind of friend would I be? Okay. Yep. I don't know, a couple years. We have to replace them. I mean, like, I'm pretty sure that I borrowed these from my professor, and I get the impression that they don't last forever. You know, potpourri. Excellent. Your smellers are in perfect working order. Alright, so I was a little bit questionable about, not questionable, I was curious about some of the movement in your face, so I'm just going to touch a little bit more, okay? Because I wrote a note about one of your cranial nerves being a little wackadoo. I not use that term. That would not be scientifically accurate. And you know me, so scientifically accurate. I'm just going to touch kind of in random places on your face and watch the muscles as I just making sure that all of it's reacting properly. Oh, we haven't been there in forever. So I can't eat out right now, and I'm not gonna ask you to pay for me. I don't. It's just way too expensive. Probably next week. I could do that next week. But you can come over to my place and I'll just make something like fajitas or something. Oh my god, I could go for fajitas like crazy. Yeah, sorry. I'm such a bummer. I hate spending money, so I'm like, I can't go do that. It's too expensive. That's what you get for having a friend that's overly frugal. I forgot the word for a second. Okay, let me put away my gear here. I would like to do just a little bit of measuring. And then, are you cool with the skin samples? Because it's kind of the main point of the experiment. Okay, good. Because I was going to kick you out if you weren't. Alright, I'm just going to measure a couple little places on your face. I'm going to measure between your eyes. And look at more variance in symmetry, which I am seeing a little bit of. Okay. Get my notes. I gotta switch away from the ear. I have to move over to the eye model. There we go. We got 7 mil. Okay. Going to measure the bridge of your nose. Okay. And your nostrils. Just get inside them. Okay. Different. So did you feel like it was hard to smell when you were just doing one nostril? Because I have that problem. One of your nostrils is bigger than the other, that's why I was asking. Okay, I'm going to measure some parts of your ear. Just get that is, we'll just get 2. Like a 3.5 maybe. What do we got? Okay. Yeah. Well, it is, I mean, that's all been proven to be complete bogus, but it is part of the foundation of what I'm doing. It's a little pseudoscience-y, but that's why I'm getting the measurements. Yeah. Okay. Oh, I know. I know it's cold though. Cold. I can kind of tell like my sleep variance depending on the temperature because my room doesn't have enough output to stay cool or warm with the rest of the house. So the temperature really affects my sleep patterns. And when it's too hot or too cold, I sleep very poorly. So I can tell you right now, it's way too freaking cold. It doesn't look like it, but it is. Okay, I'm gonna use my here we go. I needed to use this because I need to get around your head. Back. Let's do it. Okay. And around your neck. Shoulder to shoulder. It probably doesn't matter, but more information is better, in my opinion. 40. Okay. So, I'm going to collect skin samples in two different ways. First, I am going to do a scrape skin sample. Well, several. I have a couple petri dishes here. And then I'm going to use a small device that will essentially grab just a little bit of skin and any like oils from your skin. I'm just going to put it up to places on your skin and pull on it, okay? Then put them in my little petri dishes. There should be no pain to you. And if there was, I wouldn't tell you. I kid. Okay. Just a little bit of scraping, okay? And I'm gonna get it kind of near your ear, under it, to start. I want to make sure I'm getting a really good amount so that it's getting any bacteria or okay. I'd like to do a second one from a similar location. Oh, the only space I had room. The dining room is completely full of boxes right now, man. Ugh, I know. Okay. Number 2. We got one from this side. Just bringing up the skin really. Oh, am I hot? Sorry. Here gets forward. Okay. Got it on here. Petri dish number 3. Sample number 4. Alright, I'd like to get a couple more samples from each side, a little closer to your chin area, okay? I'm going to kind of scrape along. Your skin is very dry. It's making it quite easy to get skin samples. That was number 5. Number 5. Oh, we want all that. That's the whole point. I'm hoping there's tons of bacteria. I mean, there is. There's bacteria all over us all the time. It's super gross. Okay, I'd like to get one from behind your ear, so I'm just gonna go and scrape along behind. Dish number 7. Let's get behind here. Oh, sorry, I'm concentrating because it's kind of sharp and I don't want to. Yeah, I'm just focusing because contrary to our occasional teasing one another, don't actually want to hurt you. Wouldn't be good for the experiment. These are the last ones. I just wanted 10 samples like that, and then we'll get some with the extractor. Excellent. Okay. You were so good at staying still. Is that a compliment? Okay. For 10 more petri dishes, I'm going to grab samples from around the same location, but these ones are going to be a little, you might feel a little bit of suction, okay? Okay. One. 2, 3, 4, 5, 'That didn't work so good. There we go. 5, 6, right about 7, 8, 9, and last one. Hold on. There we go. Perfect. Okay, wait, before you leave, because we are done, give me 1 second just to write down 10 samples collected. Granules. And okay, final inspection. Just want to make sure that I didn't do any damage to my darling friend. I'm just going to look for any pinches or scrapes that I might have caused on your face. I'm going to poke, and I just need you to tell me if you feel any pain. Prod. Poking, prodding. Perfect. Thank you so much for doing this. I know I've been giving you a lot of shit, but seriously, I only got a couple other people to do it, so I'm gonna have to put out an ad. So thank you. Thank you for coming by. And yes, come over to my place.